What is the core symptom of PTSD? Maybe not what you think. Before we jump in, if this is your first time here, my name is Dr. McCleary, and I'm a licensed clinical psychologist and Navy veteran. And my channel is dedicated to educating veterans, service members, and their families about mental health. So if that's you, consider subscribing. So if you watch movies with people that supposedly have PTSD, or you've even tried to do your own research, you might think that maybe some of the core symptoms of PTSD are nightmares or flashbacks. And yes, those can be symptoms of PTSD. However, you can actually have PTSD and have never had a flashback or a nightmare. But let me tell you about what I believe the core symptom of PTSD is. And if you don't have this symptom, clinically, you actually don't have PTSD. And that symptom is avoidance. If you watched any of my content about PTSD, you know that I talk about avoidance a lot. And that's because it's such an important topic and symptom to talk about, because it interferes with so many aspects of somebody's life. When I talk about avoidance, I'm talking about two different kinds of avoidance, both internal avoidance and external avoidance. So let me tell you what that means. When I'm talking about internal avoidance, really what I'm talking about is avoiding emotions connected to the trauma, avoiding thoughts connected to the trauma, avoiding memories connected to the trauma. All that internal stuff that's going on in our heads. All of those things somebody can be avoiding. And for a lot of veterans and a lot of individuals, this becomes a full-time job for them. The other type of avoidance is external avoidance. And this one might be something that people are actually more familiar with. This is avoiding reminders. It's avoiding people, places, situations that remind you or trigger you about the trauma. So maybe you don't go to restaurants. If you do go to a restaurant, you need to have your back up against the wall. Maybe you don't go certain places anymore. Maybe you don't go places where you might see somebody in uniform. Maybe you don't go places where you might see somebody that might be dressed in a certain Middle Eastern attire. Yes, I went there. A common symptom. External avoidance refers to all those things that you're trying to stay away from. And for some people, this can also be another full-time job. So let's talk briefly about why I believe that avoidance is the core symptom of PTSD. It's not just because it's a criteria of PTSD, which basically means avoiding things is so common in PTSD, it's literally part of the diagnosis. Also, when it comes to avoidance, some mental health scientists and experts have studied avoidance and feel as though it can also be part of what keeps PTSD symptoms going. Because what happens when somebody experiences a trauma is obviously they don't want to experience it again, which makes sense, which causes them to avoid all types of things. They also don't want to revisit it. They don't want to feel those emotions and those thoughts and don't want to have those memories. So guess what? They avoid it. On the surface, this of course makes perfect sense. Who wants to be in pain? Who wants to revisit the arguably worst time ever in their life? I always tell the patients that I see and the veterans that I see, the service members that I see, if you came into my office and were happy to tell me the worst time in your life, you probably don't even have PTSD. That also has never happened to me before. Nobody wants to do that. So oftentimes when people experience a trauma, as I said, they immediately start avoiding internal and external stimuli. Okay, well, what happens there is that trauma often doesn't get a chance to get processed, doesn't get a chance to get worked through. And thus, those thoughts, those memories end up almost like they get stuck because we never give it a chance to actually get processed, to get worked on. It's too painful to look at, so it never gets that chance. So often, symptoms continue because of that. Those two things, one, that the criteria of PTSD requires some avoidance symptoms, and that avoiding can actually lead to a diagnosis of PTSD and can lead to symptoms persisting far long after a trauma because of avoidance, makes avoidance the core symptom of PTSD. So if you are experiencing a lot of avoidance, both internally or externally or both, my suggestion is that you get some help for that. Because avoidance is another one of those symptoms, maybe even the third symptom that makes it so important and troubling when it comes to PTSD, is avoidance interferes with our day-to-day lives so much. Now we can't go places that maybe we want to go, that maybe our kids or our partners want to go. Now maybe we can't have certain jobs. We can't go certain places. We can't talk to certain people. Well, that makes our world get real small real quick. So if that's you, I ask and I encourage you to talk to a mental health professional about it. Because at the end of the day, what you want is those choices to do certain things, to go certain places, to talk to certain people, to engage in relationships. You want those to be your choices. And you don't want PTSD to make those choices for you. Something to think about. If this video was helpful for you, and I hope that it was, please like it or consider subscribing to my channel if you want to learn more about PTSD and mental health. But more important than that, if this video was helpful for you, well, that means it can probably be helpful for another veteran or service member or friend or family member of a service member. So I ask that you share it with them. Because at the end of the day, that's really what all this is about. One veteran trying to help another.